Like in many other industries, the medical profession has become extremely competitive. I'm sure you've seen yourself on television advertisements from India and Malaysia for people to go to visit those countries for medical services. And within any specific country, the private health organisations are becoming far more competitive. So for government institutions to be able to compete in that market, they obviously have to bring themselves into the 21st century, both in terms of the services that they provide to their patients, as well as the efficiencies in which they run their hospitals. So the challenge that was faced by the Department of Health in Taiwan is 28 hospitals all running their own IT systems, applications, ordering systems for supplies, etc. And how to consolidate that into a single entity to administer all of those hospitals and to get firstly the economies of scale in terms of cost reduction, ancillary benefits from better ordering procedures, but even more importantly, being able to provide much better quality of service to their patients. So the challenge that these organisations face is, whilst they have to drive down cost, at the same time they have to improve the quality of their service. It's purely and simply, they have 28 hospitals. Some of those are on remote islands off the coast of Taiwan, and it's to ensure that they provide a much better level of service to their customers, whilst at the same time drive down their costs. There's a lot of IP in these old applications that's been built up over many years. So the choices that they face are three. They can do a complete rewrite, which is quite time consuming, usually 2 to 3 years that would take, and incurring significant cost up front. Other option, of course, is to just go and buy packaged applications off the shelf. Usually that's a 3 to 4 year exercise, and again, large expenses incurred up front. And the third option, which is what was chosen in this case, was to reuse the existing IP. The technology, the COBOL language has been around for a long time, as we know. It turned 50 quite recently. But there's an enormous amount of intellectual property that's been built into those applications over many years. What we allow organisations to do is to take that application, bring it into a centralised, in this case, but more modern, open environment, and use those cost savings to then invest back into the application and modernise that application. So first of all, drive down the cost of ownership. In this case, it was taking multiple applications and centralising them into a single environment, capturing the best of IP from the various elements from the various hospitals that they had. And then once it's in that environment, then giving a better capability, more modern capability, whether or not that's web interfaces, which in this case it was, as well as improving the user access to the user experience in working with that business application. So clearly once you've got it onto that new platform, you've modernised your application, bringing it into the 21st century, as we said earlier, but by being able to provide a platform that you can then grow forward in the future. You think about it from two perspectives. One is the people. We have a significant amount of staff maintaining multiple different applications, but their core skills are needed going forward. That experience is maintained, whilst at the same time a lot of young kids are coming out of university today learning all of the new languages, but when they look at the environment that we provided them with the AcuCobalt GT, it looks like a modern day development environment to them. So you're able to attract young people from university into this environment as well. In this particular case, it was estimated that approximately $17 million in savings were realised in not having to maintain those multiple older applications. The second thing is part of the question is relating to the technology. The technology that was used can, as I said earlier, work on an open platform, which it does. It can interact with the latest development languages, databases and so on, and of course web capability. So it does all of the things that we would expect of an application, not only today, but moving forward. What's interesting is if sometime in the future they wanted to bring down that capability to a mobile device, without having to change a line of code or any business logic, the application could also run in that type of environment. Now, what does that mean for a doctor? A doctor out in the field being able to access patient records whilst visiting them in a remote location. That's the power the technology provides. My understanding is that the next phase of the journey is to move the hospital applications onto a Windows 7 platform, and then obviously we will provide our technology to support that. Beyond that though, it gets quite interesting. As you know, many organisations are looking to drive down cost even further, and many people see the cloud computing environment as the ideal platform to do that. Again, from a Micro Focus perspective, we view cloud as simply another platform, so we will be able to move that application, again without change to lines of code or business logic, and take it into the cloud for them, which I think is very, very exciting.